Parkinson's disease is usually a slowly progressive condition. Many people live for years with symptoms that progress gradually. However, some symptoms are considered red flags because they are not typical for classic Parkinson's disease, especially when they happen early. These red flags do not automatically mean that the diagnosis is wrong, but they should raise concern for other forms of Parkinsonism, such as multiple system atrophy, progressive supranuclear palsy, corticobasal degeneration, vascular Parkinsonism, or other atypical disorders. Here are the most important red flags. Number 1. Rapid progression. If a person needs a wheelchair for mobility within 5 years of the onset of motor symptoms, and this cannot be explained by arthritis, spine disease, orthopedic problems, or another clear cause, that is a major red flag. Classic Parkinson's disease does not progress that quickly. Number 2. Severe speech problems early in the disease. Some voice changes are common in Parkinson's disease, such as a softer voice or reduced volume. But if speech becomes so severe within the first 5 years that people cannot understand what the patient is saying most of the time, that is not typical for classic Parkinson's disease. Number 3. Severe swallowing problems early in the disease. Mild swallowing difficulty can happen in Parkinson's disease, especially later. But if a person develops severe swallowing problems within the first 5 years, requiring a soft diet or a feeding tube, and this is not explained by another condition, that is a red flag. Number 4. Early frequent falls. Falls can occur in Parkinson's disease, but frequent falls very early are concerning. If someone develops recurrent falls due to balance problems within the first 3 years of symptoms, especially more than 1 fall per year, the diagnosis should be reconsidered. Number 5. Severe autonomic problems early. This includes severe urinary retention, severe urinary incontinence, or marked blood pressure drops when standing. In men, urinary symptoms should not simply be due to prostate disease. In women, mild, long-standing stress incontinence does not count. When severe urinary problems occur early, especially together with erectile dysfunction in men or major blood pressure instability, multiple system atrophy becomes an important consideration. The key point is this: one red flag does not prove that the diagnosis is wrong. But if a patient has more than 2 red flags, especially early in the disease, it is time to look carefully for atypical Parkinsonism. The best next step is to see a movement disorder specialist. Parkinson's disease and atypical Parkinsonian disorders can look similar in the beginning, but the prognosis, counseling, and management can be very different. This video is for education only and does not replace a medical evaluation. This video is for education only and does not replace a medical evaluation. Thanks for watching.